Good morning. I'm Annette Robinson, nurse practitioner, currently employed at internal medicine at Park Avenue through South Georgia Medical Center. We are providers of primary and internal medicine. What we're actually seeing is that a lot of our clients are coming in with type 2 diabetes and are not aware of their status. Some has just been diagnosed and some has been for a long time, but no guidance on how to protect themselves. We are trying to control diabetes by a combination of lifestyle changes, medication, and consistent training and monitoring of their blood sugar. We have a breakdown of the strategies that we are using. Diet, we teach them to eat right, eat smart, avoid sugary drinks, sweets, white breads, and processed foods. We also chose complex carbohydrates, whole grains, legumes, vegetables, and fruits in combination with other dietary foods. We teach them to watch portion control and also healthy fats because with diabetes, it can cause dyslipidemia, cardiovascular disease, strokes. It has a multitude of side effects if it's not controlled. We also teach them about regular exercising, at least 150 minutes per week. Also, it includes resistance training where they walk for 2 to 3 times per week. We ask them to stay consistent with their daily activity because it matters about the blood sugars. We encourage them to monitor their blood glucoses frequently depending on the treatment plan that we have and to track the trends to keep a log to understand what foods are affecting their levels. We usually start them on the first line medication, which is metformin, and then we process the treatment further. We try to do the SGLT2s and the GLP1s. We feel that if we can get them on those medications, their hemoglobin A1Cs will be better. Other oral medications can be used in addition to insulin, and it just depends on the hemoglobin A1C. We need to stick to our schedule. We teach them to try and stick to their schedule because it makes a big difference. We talk about weight management. A lot of diabetes has developed due to being overweight. We suggest that they lose 5 to 10% of their body weight, and that can significantly improve their hemoglobin A1C. They need to have a sustainable approach, focus on the gradual changes, not crash diets. They need to stay well hydrated and to monitor how much fluid they're taking in to avoid the sugary drinks and limit alcohol. They need to sleep, decrease the stress level. Poor sleep and chronic stress can raise blood sugars. We have to encourage them to try to get their sleep. They should aim for 7 to 9 hours of sleep per night. They should try stress reduction, meditation, yoga, journaling, or talking with a therapy. They need to have regular checkups. We try to bring them in every 3 months, but we tell them to continue to monitor their glucoses daily and keep a track on it to improve their outcomes. We also tell them if you need to come into the office or to call, and we will call them back. We make suggestions that if they're unable to follow through on the plans that we've given them, that they need to call us so we can refer them to a diet therapy. We are in the process of integrating more and more medicines. We also need to continue with our plan as said before. If they need any medication, sometime we can help them through a program that support folks without insurance. The biggest thing is that we need to be accountable and to help them to get whatever they need. A lot of them are still on the first line medication, metformin, because it's one of the cheaper meds. We found that a lot of the insurance companies require them to be on metformin first before they can advance to another class of drugs. We are in the process of ordering some of the medications like the GLP ones and helping them to start before they can get prior authorization or approved. The thing is with these medications, a lot of the companies are not opting in to get the medication. It's just like if we see a patient and they are not on point, we try our best to try and encourage them to try to stick to their diet and to let us know what we can do for them. We are constantly involved in their care. What I see around the clinic is if we can get medication to distribute or equipment to help with the diabetes, that's what we need to do. In our clinic, we are working hard to change the trajectory of how the medications are ordered. If the patient needs medication, some of them are given to them through our clinic, through the pharmaceutical reps. Just like Lilly has a patient assistant program, and all we need to do is fill those papers out. A lot of them does not follow through on the plan that we have for them. And what our plans are is to go into the community and encourage other providers to try and get the patients to be on schedule, like eating right, reducing stress, and taking medication. If families are involved in their care, we are more apt to stick with our plan. And leadership has a lot to do with this plan of care. We are trying our best to decrease mortality and morbidity. And the thing to do is to decrease cardiac, strokes, heart attacks, and other complications associated with that. So, with this being said, thank you for your time.